want to take a few moments today to talk about the increase in dental care costs and medical care costs that we are currently seeing. Everybody's concerned. There's no doubt that medical and dental care costs have increased. There have been a lot of opinions and unfortunately a lot of finger pointing that has been going on as well. But the opinions and the finger pointing do not solve the issues. The reality of it is that the cost of operating a dental office has gone up dramatically over the years. Unfortunately, there's the mistaken opinion that all of the revenue that's generated in dental offices goes right into the pocket of the dentist. While I wish that was true, I can guarantee you that it is not. You see, not too many years ago, it was pretty simple to have a dental practice operate on a 35 to 40% overhead. Unfortunately, nowadays that has increased to 70% and it is continuing to rise. What's the reason for all of this increase? Well, there's a number of reasons. Equipment costs and material costs have increased dramatically. But on the plus side, the technology and the materials that are available to us today allow us to give the patient the best dental health care and services available any place in the world. I see patients from other countries, and the reality of it is American dental care is second to none. So, how do we control our dental health care costs? Well, the first thing we need to do is understand that it is a joint effort. It is not just up to the dental office, it's not just up to the patient, it's not just up to the insurance company, and it's not just up to the material supplier. We are all involved with it. So, what can you do as a patient to play your role in controlling your dental health care costs? Well, one of the main costs of dental care is failed appointments. That may seem unusual, but think about it for a moment. If we don't have a patient to treat, our overhead continues. And what does that mean for you, the patient? That means increased fees. Because the overhead has to continue, we have to raise fees for the patients who do show up for their appointments. So one of the major things that you can do is, number one, keep your appointment. You see, in dentistry, different than medicine, we don't double book. We have longer appointments because what we are doing are procedures on every patient. It's not just walking in, taking a temperature, looking in the ears, and writing a prescription. These are all procedures and they do take time. Because it's a longer procedure, frequently we cannot fill those last-minute failures, and therefore our costs continue. As I said, as the overhead goes on, the fees have to increase. So what steps can you take? Well, number one, follow the approach of comprehensive care. One of the most expensive approaches is the piecemeal, emergency-based only type of approach to dental care. Work with your dentist. There's a lot of ways that we can phase treatment. All treatment does not have to be done at once. I have a number of patients in what I call my 5-year club and my 7-year club. And what that means is that we are phasing treatment over a period of years. But what we are doing is we're maintaining quality. I feel that the time should be the variable and quality should be the constant. Excellent home care. Taking responsibility for your home care and your oral health goes a long way in helping control your individual dental care costs. You see, problems don't get less expensive over time. They only get more expensive. And finally, as I said earlier, keep your appointment. If you would like more information, if you would like to discuss your dental needs, please feel free to contact us at Expressions Dental.